Good afternoon, everybody. Tess Crawley here, clinical and forensic psychologist and director of Dr. Tess Crawley and Associates. Today, I am talking to you again about depression. Now, you might not believe this, but I did a little video about depression maybe roughly a week ago. And that video got more response than some of the videos that I've actually actively promoted on the page. So I am sharing this one straight into the Stigma Rebellion, which is our closed group, so that if you want to join, you can. All you need to do is look up the Stigma Rebellion on Facebook. There it is, the Stigma Rebellion, and click on join group, and that just sends a request to me to let you in, and I will then let you in, because everybody is welcome to join the Stigma Rebellion. So after the response that the video about depression got recently, hi Chris, I can see you're with me this afternoon, nice to have you. I thought I would do a little series of videos on depression, talking about different elements of depression. I'm not going to do them all back to back like I did with the borderline personality disorder series. I'll do these videos as topics come to mind. So today I wanted to talk a little bit about the thinking that goes along with depression. So we've talked before about the different components of depression, the cognitive and affective and energy components. So the last video I did talked about those three elements. So the cognitive components of depression is that depressed thinking patterns, which I'll talk about today. The affective component is the mood and how reactive your mood is to outside stimuli, whether or not your mood is able to lift or not, depending on what you're talking about or who you're interacting with. And the energy component, the physiological component of depression, is of course how your energy levels sit, whether your appetite has been affected, whether your sleep has been affected, whether your libido has been affected. And there's that feeling of like you're dragging yourself through wet cement. So today, talking about the cognitive elements of depression. So think about when you've had a day where it feels like nothing can go right. You know how you have those days sometimes where sometimes you just wish you could climb back into bed and just start the day fresh because nothing has gone right. And there's that little inner voice in here chattering away at you going, you know, this is hopeless, this just isn't going anywhere, I might as well give up and just start again. Hi Anna, I can see you're with me this afternoon too. Nice to have you here. With those cognitive thoughts, those cognitions we call them, the thinking habits that we have in depression, it goes beyond just a day, having a bad day. It's where those thinking habits become quite ingrained and quite difficult to shake. And one of the analogies that I often use when I'm talking to people about depression is this notion of it being like you've got a bully in your head, or a bully that's following you around, yabbering at you behind your back, saying all these really nasty things that are actually designed to drag you down. So if you can imagine that depression is a little bit like an inner bully that's got you by the ankle and is really trying hard to drag you down. So when people are experiencing depression, we often look to, thanks Anna, we often look to what thinking habits they're stuck with. So the problem with depression is that depression will try to convince you that you are hopeless, that your situation is hopeless, that there is no chance that it's going to get any better, and that you are helpless, that you are beyond help, that nobody else can help you, that this situation is going to be like this forever and nothing that you or anybody else does is going to change it. So when I'm working with clients who are depressed, one of the key things I try to help them crowbar loose, if you like, is some of those assumptions, some of those depression bound assumptions about hopelessness and helplessness. So we use a range of cognitive behavioural therapy techniques to try and shift some of that loose. And one of the tricks, if you like, that I have been employing recently is using little visual cues to help people understand the difference between depressed thoughts and facts. So the fact that, if you're thinking today is awful, I might as well just give up now, that's not a fact. That's how you feel, and that's what depression is telling you. It's not the truth. There is no one truth, of course, but it's not the truth of who you are and what your day is. Your day might be going really badly. Things might not be going to plan. In fact, I've done a video about that where I had a day not long ago where things just kept not going to plan all day long. And sometimes you need to be able to step back a little bit and observe what's going on up here and say, okay, I'm hearing these thoughts, and these thoughts need to be distanced from me and not personalized by me. I need to be able to stand back and look at them a little bit separately from me and say, well, those thoughts aren't very helpful. Those thoughts are trying to grab me by the ankle and drag me down. Those thoughts are trying to keep me depressed. If those thoughts were coming out of the mouth of another person, you would stop talking to that person. Don't you think? You wouldn't certainly have them as a friend. You wouldn't invite them around for dinner. You certainly wouldn't, respect their opinion for very long. So if those thoughts were coming from the mouth of another person, after a while, you might sit up and go, hang on a minute. That's not true. I don't need to hear that. I don't like what you're saying. In fact, I don't think I want to be your friend anymore. And you would shut the door on that person. Okay, so when we're talking about depressed thinking, sometimes we need to be able to step back from those thoughts, depersonalize them a little bit, step back and look at them, and weigh up whether or not we want to choose to allow that inner bully to have as much power as it's had so far. And making that choice helps empower you to say, okay, well, what do I need to do to give me the strength to stand up to that bully? Now, sometimes that's enough. That little mental process is enough for some people to be able to stop, look at what's going on with their thinking and choose a different way, to be able to hear those thoughts and choose a different way. Now, for people who are stuck in their depression, for people who are really entrenched in their depression, that's just step one. Being able to recognize that is step one. And sometimes they need some extra help to be able to crowbar that a little bit further loose, to free them up a little bit more from those cognitive habits. So sometimes medication is a really great tool to help cut through the worst of the depression and make those cognitive processes a little easier to deal with. Certainly seeing a psychologist or a mental health social worker or mental health OT can help you crowbar some of that loose as well. In fact, the gold standard treatment for depression is cognitive behavioural therapy, so those talking therapies, and an appropriately prescribed medication. But today, to give you a little insight into one of the little visual techniques that I've started using, I've brought a very little friend along with me today. Now, I met this little fellow in Japan when I was there earlier on in the year, and cover your ears if you don't like little swear words, but his name is Bastard. Now, I didn't name him, that's his name. And he belongs to a series of characters by a Japanese artist. The main character is called Wamo, who is a teenage alien, whose best friend is called Boo, who's a little ghost. And they have a third friend called Bastard. Bastard is a teenage alien too, and he has very gnashy, mean-looking teeth. And he wouldn't bite you, but with that scary-looking mouth, he spits out a lot of really hurtful words. Now, the artist who created these three characters, she has a whole series. Each season, she brings out a new version of these three characters. They might be different colours or different styles, but they're always the same three characters. So while I was in Japan, I happened to spy this particular little bastard who caught my eye because he was a perfect illustration of depression. So here is my little friend bastard, and I'll see if I can get him to focus a little bit better. But what you can see is his innards. So he's a clear little character. I don't know if you can quite see his gnashy little teeth at the front there, but he is called Anatomy Bastard because you can see his insides. And what I loved about him, you can see these horrible little thoughts inside his head. So what I've started doing sometimes with some of my clients is bringing out my little bastard and saying, here's what your depression looks like. He's a nasty little person with horrible little teeth and a horrible mouth that spits out awful things and a head full of mess, a head full of nasty thoughts. And if you can visualize him when you're thinking about your depressed thoughts, you can say, you know what, you little bastard, I don't need to listen to you anymore. I can actually see you. I can see the thoughts that are swirling around inside your mind, and I can see the words that are going to spit out of your mouth, and I can choose whether or not to pay any attention to you. So for some of my clients, certainly some of my younger, like my adolescent clients, but even some of my grown-up clients have really taken to this guy. And what they often will do, if I can give you an example. So I get my trusty iPad and I sit my trusty bastard on there. They say, you know what, bastard, you can just shut up and bugger off. Now that's a little visual attempt at providing a really concrete version of that analogy I was talking about before, about if this was a person talking to you, you would get rid of them from your life. You wouldn't have much more to do with them. You'd turn your back on them and walk away. When we provide a visual cue in psychological therapy, it's about providing something that a client can hold on to and remember. Sometimes I've had clients say to me that when they're hearing these thinking habits in their own mind, they have said, well, what would Tess say in answer to that thought? And if that helps them distance themselves a little bit from their thinking so that they can choose whether or not to listen to it, I'm happy for clients to do that. Obviously, I don't have all the answers to all of your thoughts, but if it helps to visualize me or bastard or the bloke down the road as the person that you want to say, okay, how should I view this thought that's flying around in my head? Should I give it much weight? Should I be listening to it? Why would I choose to listen to it? If I had a choice, would I not shut the door and tell it to go away, maybe with a few choice words to follow? So if you're struggling with depression and you're looking for a simple way to get you started with challenging some of your thoughts, try that little idea. Pick something that you can use as an illustration of your inner bully. Give it a name if you want to. Use my bastard if you want to in your own thoughts, and use that to help you provide a little bit of distance from you, between you and those thoughts, to buy you some time to say, hang on a minute, I've got a choice. I've got a choice. I can choose to let this thought dictate my day, or I can choose to say, you know what, I don't need to listen to that. If you're really struggling to do that, and I can understand for some of you that might be a really big ask. So if you're really struggling to do that, then get some help. Get some help. And it's not, it's not the end of the world if you can't do that by yourself. It's a big challenge. So talk to your GP. Look at the Beyond Blue website for some phone numbers that you can call. Try some of the apps that are available. So Beyond Blue has some resources there. Sane Australia has some resources there also. Both of those websites easily accessible. Talk to a psychologist, talk to Lifeline. There are a number of resources that can help you shift your thinking. And of course, we're available if you need us too. And if you're not in our area, let us know if there's some way we can direct you to a resource in your area. So if you're not in Australia, have a look on your on the internet in your country for local resources that might help you with cognitive behavioural therapy for depression. So that's a good search to do. Resources clinical psychologists, mental health social workers. So search depression and those terms and come up with something close to you in your location. Don't forget, of course, if you place any comments on these videos, I will respond to those. And I hope that that's been a helpful start anyway to our conversation around some of the little tricks that we can use to pry loose some of those cognitions around depression, some of those unhelpful thinking habits. There's probably, if you're interested in reading a bit more about how to shake some of that, I can recommend The Happiness Trap, which is a book written by an Australian called Russ Harris. Now that's cognitive behavioural therapy and acceptance and commitment therapy strategies in that book. And that's a really good place to start. It's a really easy read, so you can try that one. That's all for me today. The next time I come up with a topic for depression, I'll certainly let you know, and we'll have another chat about that. If you've got other topics you would like me to cover, please do let me know in the comments. Otherwise, I look forward to talking to you again tomorrow. Have a fabulous evening. Bye-bye for now.